who work in the North Surrey area, and it's our pleasure to present to you interdisciplinary care outcomes for low back pain patients. This is supported by the British Columbia Chiropractic Association. We have no commercial interest to disclose. We were provided nominal funding by the BC Chiropractors Association to participate in this initiative. This was a proof of concept study to see over the course of 1 year how working together with a family physician and a chiropractor could improve care outcomes for low back pain patients. I have to give credit to the Practice Support Program for introducing me to this initiative. And when I first heard about the opportunity to get to know a local chiropractor in my community and work with them to improve low back pain patients and provide free access to chiropractic care, I jumped at that opportunity. Chiropractors are well trained in the treatment of musculoskeletal conditions, particularly of the spine and population. Low back pain is a very common presentation in the primary care setting. Up to 30% of primary care visits are musculoskeletal in nature, with the most common being lower back pain being the most common disorder. Some surveys say that the 5th most common reason for presentation in the primary care setting is low back pain. As such, BC Chiropractic Association wanted to see that if utilizing chiropractors in this way could offload pressure from the primary care system and improve access. Due in part to the opioid crisis, there is now a greater emphasis on non-pharmacological management of pain. I'll pass it.
Hello, I'm Jasminder Panu. So this was a partnership between chiropractors and medical doctors. There was 4 clinics involved with 72 patients. There was 2 clinical outcome measures that we used for this. One was a numeric pain rating scale, and the second was the Osteoarthritis Disability Index. And the interviews, there was interviews done with practitioners as well as survey of patients. So a lot of our patients, sorry, one sec. They didn't have any medical coverage, and there was quite a bit of multiple physical or mental health issues. In this instance, we did not have any WCB or ICBC patients coming in for this project.
Yeah, we can see it here. My partner is left, so I can't sit here at the tech time. I think we're
Just use one of the two, just keep interacting with the audience. So forget about the screen first, focus on the two first.
Of the patients showed improvement of 3 points or more. There is supposed to be a graph here. I would love to show you. Oh, is it on the handout? Is it on the handout? Awesome. It's the first part where it says 90% improvement. So the handout, the graph shows that the numeric pain rating scale, the scores are from 0 to 10. 0 is the least amount of pain, and 10 is the most amount of pain. And the scores are basically their changes from pre and post changes in each patient. And then non-chronic cases were the ones that showed the most improvement in this case. Also, these changes may be underestimated since many of the patients had limited follow-up time. If they had been followed up for more of a duration of the treatment, their pre and post changes might have been larger. And there's a second graph, so we're on the second part of the graph. 62% showed that the Osteoarthritis Disability Index, there was improvement in that. And 31% was increased in 21 points or more, so there was improvement 31% in this case. Again, the changes could be underestimated. patients had a limited follow-up time. So again, if they had followed up for the full duration of the treatment, the changes could have been, the pre and post changes could have been different. The Ost-West Disability Index score, 0 to 20 is usually minimal disability, and 81 to 100 is more of a bedbound or an exaggeration type of severe disability. And the scores, as you can see, shows the pre and post changes for each patient. You see in the diagram. And also it shows the distribution of change scores from the first visit to the last visit for these patients. And again, non-chronic cases did show the most improvement.
So in terms of the patient feedback surveys, 100% agreed that their quality of life improved. 100% also agreed that their low back pain was treated more quickly. Also agreed they relied less on medication to help manage their lower back pain, and they placed high value in the education and advice they received from their chiropractor in order to manage their pain. For example, a patient of mine would say that although he still has low back pain occasionally, he knows exactly what he needs to do to manage his lower back pain, whether that means exercises, stretches, positions of relief, or going back to the chiropractor for another treatment. 85% agreed that their ability to perform daily activities increased as a result of seeing the chiropractor. In terms of provider feedback, all the providers, physicians, and chiropractors interviewed stated that they would participate again in this initiative, and they were overall satisfied with the communication. However, GPs may have preferred more succinct communication versus chiropractors may provide more detailed exam findings. From my perspective, in terms of lessons learned, just getting to know Jax, her treatment style and her approach improved my confidence in referring, and on the flip side, improved the patient's comfort level in going to a chiropractor that they knew I recommended and they knew I had ongoing interaction and communication with.
So some of the lessons learned here was that team care was very effective. We had a great relationship, great working relationship. The collaboration was wonderful. I would say that we felt that the free treatment contributed to improved access for these patients, as well as the initiative was considered to provide an additional treatment modality for physicians to provide this type of care. So the participating physicians noted that they may build confidence in an individual chiropractor. So they don't know what to expect from chiropractors in general. So having that relationship, having a chiropractor meet with a physician, having that initial meeting is something that we do recommend.
Has it unsynced again for you? You need the 10%? Yeah.
Well, we're almost done.
Okay.
So the next slide is recommendations. So for recommendations, there's some, I would like to address patient barriers. So some patient barriers such as having difficulty for a patient to be referred over to a chiropractor, even though you don't need to have a referral to see a chiropractor. BCCA, British Columbia Chiropractic Association, can explore into preparing communication materials for patients that could be provided at the point of referral, such as cost, value of treatment, info about coverage, details regarding transportation, great connection that way to our patients as well. Another thing is that it's important that in the study it was more chronic patients that came in. It's also important that more more acute, subacute recurring patients be referred if we were to do this again.
Yeah, I guess I would just add, perhaps in the past I may have left chiropractors maybe a second or maybe a third line approach after doing this initiative. It may be a more first line approach, especially for acute or subacute lower back pain, where they can have quick and sustained results. For more chronic pain, it tends to be more of a maintenance care, and that's what we tend to be training our patients how to maintain their spine, maintain their back, and a chiropractor can assist with that portion as well. And I think that's it. Thank you, everyone, and thank you to Lisa for developing this and putting this all together for us to present.
Really useful. I'm just wondering in future if there's plans to measure increased access with support with Chiro, so if it's reducing the number of times the patient's coming to see the physician, thus creating more access for others.
I guess I could say subjectively, I noticed if my patients were following with JAS, they would be less likely coming to me, but I don't think we actually measured that in this particular study, but that would be a good idea.
And another point is, it's important to address that medical doctors have waiting lists for a week, 2 weeks, and longer. I do have a lot of patients that come in and would love to see their medical doctor the next day or the day after, but it's very difficult to get into their doctor sometimes. So taking that pressure off the medical doctors and off the system, I think is very important, and to have other healthcare practitioners take over some of the spinal conditions that the medical doctors can have space to see other more emergency cases.